Hello friends, so in this video I am going to give you the explanation of the laboratory findings of ITP and also the explanation of the clinical features of ITP. Now I am going to tell you what are the laboratory findings found in ITP. The first one is the increased bleeding time, and the second one is the low platelet count, third one is the less number of platelets in the peripheral sphere, and the fourth one is the increased number of megakaryocytes of bone marrow, and the fifth one is the anti-IgG antibody in serum of the patient. So these are the laboratory findings. And also clinical features of ITP are the first one is the petechial hemorrhage, second one is the nasal bleeding, third one is the menorrhagic in women, fourth one is the intracranial hemorrhage, fifth one is the melena, and the sixth one is the hematuria. All these are the clinical features of ITP. So let's first begin with the explanation or the causes of the abnormal laboratory findings of ITP. Let's begin. Friends, so now I am going to give you the explanation or the causes of the abnormal laboratory findings. So let us first discuss the cause of increased bleeding time. So if you want to know the cause of increased bleeding time, then first of all you should know what is the definition of bleeding time. So for knowing a definition of bleeding time, so let us consider a pathological condition that leads to a cut injury in your finger. Now you can really observe that from that cut injury in the finger, so your bleeding starts to occur, but after a fixed interval of time that bleeding stops spontaneously, and that time period between the bleeding and the spontaneous stoppage of the bleeding is known as bleeding time. So the definition of bleeding time is that the time interval between the bleeding and the spontaneous stoppage of bleeding is known as the bleeding time. Now the normal range of bleeding time is 1 to 9 minutes. So I have given you the definition of bleeding time and the normal range of bleeding time. Now, so friends, now see this diagram. So if you can see this diagram, so you can relate that when any cut injury is done, so then bleeding occurs. But after the bleeding, so here automatic, so here blood clot formation is done, and due to this blood clot formation, so here further bleeding is prevented. So therefore blood clot is responsible in order to stop bleeding. Now again see this diagram. So if you see this diagram, you can relate that this blood clot is formed by platelets. So in a normal healthy individual where the number of platelets is in the normal range, in such case, so here that is after a bleeding occurs, then the bleeding stops spontaneously, and the bleeding time is also normal. Why? Because the proper blood clot formation is done, and after the blood clot formation no bleeding occurs and the bleeding stops. So this is a normal situation or a normal healthy person situation. But now I want to discuss the case of ITP, that means immunothrombocytic purpura. So as you already know that in case of ITP the number of platelets is less, so therefore that due to less platelet count the blood clot formation which is done is also not proper, it is very weak. So due to weak or not proper blood clot formation, the bleeding starts to continue even after the blood clot is formed. So therefore excessive bleeding occurs. Now so in case of ITP, so whenever a bleeding occurs, then also the bleeding stops spontaneously, but the time interval between the bleeding and the spontaneous stoppage of the bleeding is very high. It is not within the range of 1 to 9 minutes. So therefore in such persons, so here that is having ITP, bleeding time increases. Why? Because of low platelet count, and this low platelet count so here forms or leads to improper blood clot formation. So as a result, so here excessive, so here bleeding occurs even after the blood clot formation is done. So therefore that is bleeding time increases. So the first explanation of the increased bleeding time I have given you. So now let's discuss about the second cause. So here low platelet count. So as you already know that In case of ITP, that is immunothrombocytic purpura, that is the platelets are formed by the bone marrow, but the platelets are destroyed by the antiplatelet autoantibodies, and due to this destruction the platelet count is reduced. So therefore this is the reason for the second. Now third, so if you see the, so here serum patient, so in the serum of patient, so here antibody IgG antibody found. Why? Because all these are the antibody IgG antibodies are the antiplatelet autoantibodies which destroy the platelets. So the third reason is also done. Now the fourth, so here that is if you that in the peripheral sphere also, so here less platelets are found. Why? Because of the antiplatelet autoantibodies which cause the destruction of the platelets. So the fourth region. Now the fifth region, that is why does the number of megakaryocytes increase in the platelets. Now I am going to give the region. The main reason for this is the negative regulatory signal that goes to the bone marrow. So first of all, that you should know that in bone marrow there are megakaryocytes, and these megakaryocytes, so here produce platelets, and these platelets come in the blood circulation. But as you already know that in case of ITP, bone marrow is normal, so therefore that is the megakaryocytes are forming the normal number of platelets, but the autoantibody is destroying the platelets, so therefore again there is a negative regulatory signal goes to the bone marrow, and due to this, so bone marrow increases the megakaryocytes production, and these megakaryocytes will increase the platelet production. And also I am going to explain this. So here increased number of megakaryocytes with the help of a diagram. So friends, as you already know that in bone marrow megakaryocytes are there, and these megakaryocytes of bone marrow produce platelets. So this is a normal situation, and you should also know that this ITP immunothrombocytic purpura is a type or a class of megakaryocytic thrombocytopenia. See that. So in megakaryocytic thrombocytopenia or ITP, so here platelet count is low, as you already know the region, and this megakaryocytic thrombocytopenia, so here that is gives negative regulatory signal to the megakaryocytes of bone marrow. So due to that negative regulatory signal, so here megakaryocytes of bone marrow increase the platelets production, and due to this, so here the number of megakaryocytes also increases in bone marrow. Why? Because when the number of megakaryocytes in the bone marrow will increase, then only the number of platelets will be increased. So this is the region. See what I have written. So laboratory findings of ITP. So the first one is the increased bleeding time. So first I have explained what is bleeding time. That is the time between the cut injury that leads bleeding and the spontaneous stoppage of bleeding, and that time is known as bleeding time. So this is a definition of bleeding time. Now here normal bleeding time range, it is 1 to 9 minutes. So when bleeding time that is BT greater than 9 minutes, then bleeding disorders occur. So this is a very important point or text that you should remember. Now note that, so here whenever any injury done, then the bleeding occurs, but the platelets do blood clotting, so and this blood clotting stops further bleeding. So this is a case of a normal human being or in a person where the number of platelets is normal. But now I am going to discuss the case of thrombocytopenia, which I have written in a red color. As you already know that in thrombocytopenia the number of platelets is low, so therefore see that due to low platelet count there is no blood clot formation done properly. So therefore that is bleeding continues to occur though blood clot formation is done. So therefore that is bleeding stops after prolonged time interval, and this leads to increase in bleeding time. So therefore bleeding time increases. So therefore main summary for the increased bleeding time is that is low platelet count, and this low platelet count leads to increased bleeding time. So this is the cause of increased bleeding time. Now the second cause, so here low platelet count. So here due to immunologic platelet destruction done by antiplatelet autoantibodies. So this is the reason for a low platelet count. So here now a peripheral spear examination. So due to immunologic platelet destruction, so here low platelets found on the peripheral spear. Now this is a very important, that is increased megakaryocytes in bone marrow. So first of all I have so here given you that is the definition of megakaryocytes. You should know that megakaryocytes are the large cells in the bone marrow which produce platelets. Now in ITP there is no bone marrow defect and there are antiplatelet autoantibodies which destroy the platelets, so thrombocytopenia occurs. So therefore that this decrease in platelet count gives a negative regulatory signal to the bone marrow and this leads to increase in megakaryocytes. So therefore that is more number of megakaryocytes in bone marrow, so therefore more number of platelets form. So this is the reason for the increased megakaryocytes in bone marrow. So therefore see that increased megakaryocytes in bone marrow, it is due to negative regulatory signal in the bone marrow. Now here that is antiplatelet IgG antibody also found in the serum of the patients who have that this is the antiplatelet autoantibody which causes immunologic platelet destruction, and this antibody present in the serum, and this serum will cause a destruction of the platelets. So these are the written portions of the abnormal laboratory findings. So now I am going to give you the cause or the reason for the occurrence of the clinical features of ITP, that is immunothrombocytic purpura. So there are many clinical features in ITP which are like that. The first one is a petechial hemorrhage, second one is a nasal bleeding, and the third one is a menorrhagic in women, and the fourth one is a bleeding from gums. All these are the clinical features. But you should know that the main cause of all these clinical features is the bleeding disorder. So now I am going to explain you how this bleeding disorder caused in ITP. So friends, as you already know that in case of ITP, that is the platelet count is reduced, and the platelet count is reduced because there are antiplatelet autoantibodies formed, and these antiplatelet autoantibodies cause the destruction of the platelets. As a result, platelet count is reduced. First thing. And second, next also you should know that the proper blood clot formation is done when the number of platelets is in the normal range, or it is high or the normal range. But you know that in case of ITP the number of platelet is reduced, so therefore that due to low platelet count the blood clot formation is also not done properly as the number of platelet is low. Now due to improper or poor blood clot formation, that is bleeding continues to occur even after the blood clot is formed. So therefore that the bleeding continues to occur even after the blood clot is done, and that this condition leads to excessive bleeding, and this condition is also known as bleeding disorder. So simply you can understand the first one is the low platelet count. Next, due to low platelet count, that is the blood clot formation is affected, so therefore proper blood clot is not formed. Number third, that is bleeding continues to occur even after the blood clot is formed. As a result, number four, bleeding disorder occurs. Now, so this is the main cause of the bleeding disorder. Now, this bleeding disorder leads to excessive bleeding in various body parts and tissues. So this is the main cause of the bleeding disorder. Now, when this excessive bleeding occurs in various body parts and tissues, then the following terms are clinical features occur. Now, when excessive bleeding occurs in skin, then petechial hemorrhage occurs. When excessive bleeding occurs in nose, nasal bleeding occurs. When excessive bleeding occurs in brain, intracranial hemorrhage occurs. When excessive bleeding occurs in mucosa of palate, that is easy bruising mucosal bleeding occurs. And when excessive bleeding occurs in women during the menstruation, then menorrhagia occurs. So all these are the reasons for the clinical features. And also that you should know that is the cause of hematuria and melena. So first of all that you should know that hematuria is the blood in urine. So that when this blood also comes in the urine because of excessive bleeding. So therefore that due to excessive bleeding, blood comes in urine. So therefore hematuria is done, and melena, that means blood in stool. So due to excessive bleeding also blood comes in the stool. So therefore melena occurs. So all these are the causes of the clinical features. So I've written about clinical features of ITP. The first one is a petechial hemorrhages. Second was a easy bruising mucosal bleeding, and the third one is the menorrhagic in women, and the fourth one is a nasal bleeding. Fifth one, that is bleeding from gums. Sixth one is a melena. Seventh one is a hematuria, and eighth one is the intracranial hemorrhage. So all these are the clinical features of ITP. Now, the cause of all the following above mentioned clinical features is bleeding disorder. So here now I have explained how is bleeding disorder caused. So see that in ITP, their platelet count is reduced. So due to low platelet count, so here blood clot formation is affected, and therefore that is bleeding continues to occur for a prolonged interval after blood clot formation is done. So therefore there is bleeding disorder occurs. So therefore you should know that is low platelet count leads bleeding disorder, and this bleeding disorder causes excessive bleeding in body tissues and organs. So in this way that is bleeding disorder occurs, and also that you should know that when the following pathological conditions occur when excessive bleeding disorder done in the following organs and tissues, or simply you can say when excessive bleeding done in the following organs and tissues, then the following pathological conditions occur. The first one is a petechial hemorrhage, excessive bleeding in skin. Second one is a menorrhagic event, excessive bleeding during menstruation in women. A nasal bleeding, excessive bleeding in nose. So here bleeding from gums, excessive bleeding in mouth gums, and then easy bruising in mucosal bleeding, so excessive bleeding in the mucosa of palate. And the sixth one is the intracranial hemorrhage, excessive bleeding in the brain. And also cause of hematuria. So here that is first I'll explain what is hematuria. Hematuria is the blood in urine, and due to excessive bleeding, so here blood goes in the urine. Now here that is cause of melena. So here that is melena is the blood in the stool. So here due to excessive bleeding, so here blood goes in the stool. So therefore that is melena occurs. So these are the certain portions of clinical features. So friends, so finally the video comes to an end, and in this video I explained to you about the causes of the laboratory findings of the ITP, and also what are the clinical features of ITP. So I hope that this video helps you a lot. So please stay tuned.